Hey y'all, it's Charda from Melanin Milk SD, and today we're going to talk about nipples. So more specifically, we're going to talk about what you can do if your nipples look like this, inverted, if they are short-shanked, if they might be misshapen or puffy, or if they're just flat, super flat. So we're going to talk about different nipple shapes and specifically around pregnancy and what you can do prenatally to help yourself prepare for breastfeeding if you choose to do so. So I get this question a lot. What can I do while I'm pregnant to help myself prepare for breastfeeding? Especially if you're thinking that you may have some type of issue or you already spoke with the lactation consultant and they gave you some advice to maybe wear something like breast shells in order to help your nipple protrude a little bit more when it comes time to breastfeed after you give birth. Now, keep in mind, you don't have to do anything to prepare for breastfeeding. You can always just wait and see. I love the wait and see approach. You don't have to do anything proactively. You can just wait. And so for some people, waiting is not enough. Some people are like, I don't want to wait and see. I need to do something now. And that's okay. If you feel like there's something that you want to do that will put you at ease and give you some peace of mind going into your breastfeeding journey, then there are some things that you can try. So today we're going to check out something that I received, the Nipple Xtender 2.0 by Cradle Plus, which is a brand for pregnancy, baby, and toddlers. This little tool is said to correct, reshapen, and repair your nipples depending on what you're looking for, and we're going to check it out. Okay, so the Nipple Corrector, Nipple Xtender 2.0, comes with a couple different sizes, as you can see here. It also has this tubing that attaches to this motor, and this works similarly to a breast pump in the way that it just suctions, and it has these little suction cups that you're going to attach to your nipples, and I'm going to show you on this little handy-dandy breast model that I have here. The Nipple Xtender 2.0. It's a pretty cute little round thing. It's got a little weight to it. It's not super heavy. It has a little hole here, little port, and this is for the tubing that you're going to attach to it. This little port here is for charging because it is rechargeable, and we will go through the different modes and functionalities of this in just a second. This is actually the screen. I know it looks like a mirror, but it is actually the screen. Okay, so here's the tubing that it comes with. It comes with the standard Y tubing, which you see a lot for double breast pumps. And so I actually have already attached this, but just for purposes of showing you how it works, these will come like unattached and you will need to attach these. So you attach these to here. Make sure they're on securely, because just like with, it's a wishbone, because just like with your breast pump, if these aren't attached securely, the suction will not be adequate and it may not work efficiently or effectively for you. So this is our Y tubing here that we've created. We're now going to attach this little tube to this little hole here. It looks like a piggy. This looks like the booty. I'm super silly today. So we're going to attach this little plug here. Okay. But it comes with your little suction cups, okay? These are the medium, the middle size. Yeah, medium. It has the letter on there to indicate what size it is. So this is medium. These will come unattached, because you'll need to find which size works best for you. They're kind of like a little bell shape or a little speakerphone. A little speakerphone. I'm just, ignore me today. We have our whole unit attached. We have these tubes. We have these cups. So we're going to find which size works best for you. Comes with a size small, medium, large. Here they are all together. So we take our tubing, we attach it to our little suction cup, or our little speakerphone as our little suction cup. Now let's get ready to see how it works. When you get it, you should charge the battery for 2 hours before the first use. So it comes with a standard USB cable that you plug in here to charge it. The battery of this is not replaceable. If it goes out, you will have to replace the whole product. So the different modes it has is correct, reshape, and repair. Let's turn it on and see what these different modes are for. So you can see here, it says CRT. That does not stand for critical race theory. It stands for correct on this machine, and the correcting mode is for flat or retracted or inverted nipples. You can hear it's moderately noisy. It's not like super noisy. You can't hear it over me talking, so that's a good sign. So we've got it on the correct mode, and this is for flat or inverted nipples. So here's an inverted nipple, what an inverted nipple would look like. If your nipple goes in, even if it comes out or if it doesn't come out with stimulation, that would be an inverted nipple. And this would be a flat nipple. So I have it on the correct mode, and it gets a little bit quieter once you actually have the device on. So the correct mode is good for inverted or flat nipples. You can use this mode for up to 15 minutes, and it says that it should be painless, which I believe it should be. If there is any pain, you need to turn it off right away. If I press the power button again, it now takes us to the reshape mode. And what it's doing here is it is massaging the nipple, the corrected nipple, back to its original shape. Okay, so now we're going to change it to the repair mode. So this is the repair mode. So the repair mode is actually repairing damaged nipple tissue by improving the blood circulation to corrected nipples. So this is our small. This is our this is a medium. This is a large. You want to be sure that you have the right size for your nipple to make sure that there is no pain or discomfort. If you have any skin allergies to this, or you develop them, or if you start to have uterine contractions, stop using it. And then to clean it, it's pretty simple. This part is not waterproof. This tubing cannot be cleaned with water in it because the water in the tubing will not be able to get out. It will create a mold buildup, and that won't be good. It can also go back into the motor and damage the motor. So all we're gonna do, you could probably take like a Lysol wipe and wipe down this little unit just for cleanliness and sanitary purposes. But for the device itself, all you need to do is clean these little collection cups or these little nipple cups. And you want to just clean these with soap and water, sterilize them in hot water, and then let them air dry, like on a paper towel or something. Leave those to air dry completely, like overnight or something, and then go back to using them the next day. These should not be wet when you apply them. After you use them, I would recommend maybe trying some coconut oil or some nipple balm on your breast or your nipples, just because there might be like some level of irritation just from getting used to a different sensation on your nipples, or a sensation that you've never felt before. This is the same advice that I give for people when they are using a breast pump. I like to tell them just to keep their nipples protected and moisturized with a little bit of oil, just to make sure that everything is just to make sure we're preventing cracks or damage to our nipples and breasts from constant stimulation. While this is a prenatal tool, it can be used during breastfeeding 30 minutes before the breastfeeding session. However, you do not want to get any milk in the tubing. Liquid whatsoever should go in this tubing, because it will damage the machine and the motor, and it will not work anymore, and you will have to replace the entire unit. And as this says, it is safe for use during pregnancy. You always want to check with your midwife or your OBGYN to ask them if this is safe for you to use. Nipple stimulation, especially more aggressive or proactive nipple stimulation, can increase your chances of preterm labor if you are at risk for preterm labor. So you do want to avoid using this if you know that you are at risk for preterm labor, or if you're not sure if you're at risk for preterm labor. Can and will cause the release of oxytocin. Use it as much as you're comfortable. If you want to use it once a day, that should be fine. If you want to use it multiple times a day, that should be fine too. This is not an overnight success tool. This is not something that's going to work instantly to bring out your nipples and keep them out permanently. This is something that you want to use over time with consistency to build up to having a more shapen nipple. And over time, it should reduce the degree of the reversion or the retraction, okay? When I was saying up to 15 minutes, up to 10 minutes, up to 20 minutes on those different modes, that is up to. So you don't have to do that entire length of time. You can do shorter. I wouldn't recommend doing longer, but you can do shorter in little spurts throughout the day. If you use it more than once a day, you wanna wait for about 5 to 8 hours apart in using it. Again, if you have any pain or bleeding with this tool, I would say that you should stop using it. If you start to notice that due to mammary gland stimulation, you'd start to notice a little bit of a clear watery substance, or you start to notice that you have what is actually colostrum leaking from your breast, that is okay. Milk production actually begins in the pregnant body between 16 and 20 weeks gestation. So if you are using it in your third trimester and you start to notice that you have a little bit of leakage, that is okay. But again, make sure that that leakage doesn't go back into the tubing of the device. And you can always collect or harvest your colostrum by saving it in the freezer and taking it to your birth. You can breastfeed with inverted nipples, short shank nipples, puffy nipples, flat nipples. You can breastfeed with all these nipple shapes. You know why? Because it's called breastfeeding, not nipple feeding. So just remember that as long as you do your best and you do it your way and you are happy and you are comfortable doing it, then you are going to be just fine. Xtender Nipple Corrector by Cradle Plus for pregnancy, baby, and toddlers. Again, it is to be used prenatally. If you are looking for a breastfeeding prep tool, some people, like I said, like to use breast shells, and I do believe that Cradle Plus also sells breast shells, but this can be an additional tool in your kit if you are looking to do something a little bit more proactively. Again, you do not have to do anything proactively to prepare yourself for breastfeeding, but some people do like to do something, and I like to give people options when they ask me, what can I do? Is there something I can do? I want to do something. I don't want to just tell them, no, there's nothing you can do. There's nothing that you can try. You should just suffer and be anxious and have super high anxiety because you're worried about it. I don't want to give anybody any more anxiety going into their breastfeeding journey than they already are going to have in those first couple of days to weeks. So I like to give people options. So I do believe that this is a good option to try, again, if you're interested in doing something prenatally to help reshape and correct or repair your inverted nipples if they're inverted. Also keep in mind there's different types of inversions or retracted nipples. Some do go in and stay in, some go in and come out with stimulation. It doesn't really matter which kind of inversion you have with this. If it goes in and it stays in all the time, that might not be something that this is necessarily going to pull out, but it might help with the blood flow and it might help with the blood flow and the circulation in that repair mode. So just something that you might want to show to your lactation consultant if you are dealing with, like I said, inverted or retracted nipples, if you have misshapen nipples, puffy nipples, maybe elastic nipples, if you have short shank nipples, if you have flat nipples, if you have a nipple that you believe to be a tricky nipple. And I hope that this walkthrough of this product was helpful for you. And if this is something that you're interested in purchasing for yourself, the link to this product will be in the bottom of this video. You can also visit my link tree on my different social media sites for different things like promo codes for products, and just to find out a little bit more about what Melanin Milk does. So thank you so much for watching, and I hope that you have a great pregnancy if you are pregnant, and I'm wishing you all the positive vibes for your birth. You're gonna do great. And if you decide to breastfeed after you give birth and you need some breastfeeding or chest feeding tips, you know where to find me. I will be here for you, and hopefully I can help guide you through this journey. Happy birthing, happy feeding, and hope to see you soon.